everyone, and welcome to the latest press briefing here on the coronavirus. I'm Donna Bush. Welcome to our CIG TV viewers, as well as those on our social media platforms and those listening on Radio Cayman. A reminder that if you have new or unanswered questions, you can send those to gov.ky /coronavirus. Just go on there and check. Those questions should be answered there for you, as they are all categorized. Also, if you need to renew or apply for a new business license or renew your vehicle licenses, or to do other business online, you should go online to eservices.gov.ky. Just that information there for those who may want the correct information. Before we go to our panelists this afternoon, we begin with a prayer from Pastor Sean Knight.
Father, your word declares that if we call unto you, you will answer us and show us great and mighty things. You are an ever-present help in a time of need. You have promised to keep us in perfect peace when our minds are fixed on you. We look to you, for we know no greater source of power or authority. Give us today your guidance, strength, wisdom, and protection, especially for the most vulnerable among us. Thank you for our government and for those working on the front line of this pandemic. Show yourself strong on their behalf. Bring us through this season of difficulty and emerging threat, as only you can deliver. God, we ask that you bless these Cayman Islands. We ask this in the authority of the name of Jesus. Amen.
And thank you, Pastor Knight. We'd now like to introduce to you our panelists, who are His Excellency the Governor, Premier the Honorable Alden McLaughlin, Minister for Health, the Honorable Dwayne Seymour. We also have in studio with us the Chief Medical Officer of Health, Dr. John Lee, Commissioner of Police, Mr. Derek Byrne, and of course, we'd like to welcome our sign language interpreter, Miss Carolyn Powell. And of course, we have the media that are joining us by Zoom out of their homes. Welcome to everyone. We'll begin now with Dr. Lee.
Good afternoon. There are 114 results added today, of which 4 are positive from students who are staying in the government facility, and 2 were contacts of previous cases that have been reported. So a total of 6 positives reported today, bringing the total number of positives to 45. The breakdown for the status of people around the islands is that there are 2 hospitalized patients with COVID-19, 21 people who remain symptomatic with symptoms managing at home, 2 have clinically recovered, and 5 have fully recovered. On Cayman Brac, 17 people have been tested overall, and there is 1 positive case still who is doing well, and 16 negative. Thank you.
Okay, and thank you to Dr. Lee for that update. Do we have any questions from members of the media to Dr. Lee at this time? If not, we'll move on to Commissioner Byrne. Okay, we have a question from the Cayman Compass from Reshma. Please go ahead with your question, Reshma.
Thank you, Donna. Good afternoon. Dr. Lee, can you say if we have started testing our frontline workers now that we have the BA flight and the supplies officially on island?
We haven't started testing that, no. We previously explained there are lots of different parts in the chain which we need to sort out. I would imagine that we would start more widespread testing towards the end of this week, hopefully Friday-ish, but that still needs to be confirmed. Some of the things we have to think about is not only the amount of equipment that's available, but also the capacity of the laboratory to process all of the different steps to produce the results. And there's a lot of work going on at the moment to see if we can share capacity from the 3 different hospitals, all who have different abilities in this regard, in order to improve the testing capacity. But within a short space of time, we should be able to test considerably more people than we currently can.
Okay, do we have any?
Sorry, thank you, Dr. Lee. Just to talk a little about the assessment tool that is now available to the public. If you do have any numbers that you can share with us for those who are accessing that, and maybe because I've gotten some comments coming in, to advise the public if this is not a diagnostic tool, but rather just a self-check, so that this does not tell you that you do have it or you don't have it, and use that as a medical diagnosis that you can continue on without taking the necessary precautions.
Absolutely, I'd entirely support that, Reshma, that it's a tool to answer some of your questions at most of the steps where if there are any concerns at all, it points you on to a healthcare provider or the flu hotline. The number of people that have accessed it's pretty amazing. It's 4,214 as of about midday today, when you sent me the question.
Are there any more questions from the media for?
Yeah.
All right,
Wendy, we hear
Wendy,
you.
go ahead. Wendy Ledger from CNS, please go ahead.
Thank you very much. I just wanted to go back to Dr. Lee to get him to give us a bit more information about the situation of other facilities testing, especially when we get these 200,000 test kits from South Korea. It seems as though we will need all hands on deck. Can you explain what quality control issues that you might be having with other facilities, what the barriers are to these other facilities, not just Health City and the Doctors Hospital, but also other clinicians and private practice on the island? Because I would imagine the more people that are testing, the better.
Wendy, that sounds like you could have a whole show about this particular topic, and I'm certainly learning as I go along an awful lot more information about testing. There are a great deal of steps. You're quite right. There are a great deal of steps, and at every step there must be appropriate quality checks and quality control checks in order that we can trust the results that come out the other end. At the moment, the only enterprise that's approved to test with PCR, with the PCR technique and with any technique, is the Health Services Authority. As we all know, the Doctors Hospital is working towards getting that same PCR system up and running. The Health City do not have the ability to do the polymerase chain reaction test. They don't have the machine, and I don't think they have any intention to do so in the short term. However, they do have laboratory skills and laboratory equipment, such as the correct level of cabinet to deal with biohazardous material. And so they may be able to help with some steps in order that we will get much more of a factory sort of conveyor belt type process to process things. But yes, you're absolutely right. Being able to assure ourselves of the results is paramount in this process.
I do have
Can I just get a quick clarity on that, which means then at this point, the HSA remains the only place, even with 200,000 test kits, where people will be able to get tested?
That's correct.
I do have a question from the public, and then we're going to go to Reshma from the Cayman Compass. Dr. Lee, can you say whether the 4 students who are now positive are still in quarantine at the same facility?
Yes, they are.
Okay, thank you. Reshma, please go ahead.
Sorry, Donna, you took my question. I was going to ask the same thing about the student status and if they're at the isolation facility, if they've been released, the positive students. But also, okay. Dr. Lee, can you tell us how many more students remain to be tested, or if that we have completed all the students who are at the facility now?
I wasn't expecting that question.
I'm sorry.
So there were 75 students that have been tested so far, of which 71 are negative and 4 are positive. I don't know the number of outstanding, absolutely, I'm sorry. I know there are some that are still going through the system. I would imagine it's around 40, but I'm not absolutely certain.
Okay, if that's it for questions for Dr. Lee, we'd like to now call on Commissioner Byrne to give us an update from the police.
Good afternoon. Reporting overnight. Very quiet overnight. No significant issues of a policing nature arising. Crime remains very stable, and the hard curfew period continues to operate quite well across the islands. Looking at Little Cayman last night, no issues arising. Cayman Brac, 21 vehicles intercepted by police, no breach of curfew detected. Grand Cayman, 109 vehicles intercepted by police, no breaches of curfew detected. Since 6 a.m. this morning, 2 persons have been found in breach of soft curfew, both conducting commercial works without exemption. Business at the supermarkets, banks, pharmacy and gas stations is operating without incident this morning, being well managed, well controlled, and all persons are following social distancing protocols. There is activity on our beaches with persons out walking and a small number of persons in the water swimming. Our helicopter and marine units continue to be deployed on extended tours monitoring the marine and ground activity. A quick reminder that the daily exercise period Monday to Saturday is between 6 a.m. and 6 p.m. Just one issue that if I could mention today, speeding dump trucks. It's been repeatedly mentioned and reported to our command centre. I have previously raised it here at media briefings, but it continues to cause concern for road users, with a number of complaints being received that some of these trucks are driving at very high speeds in a reckless manner. Our roads policing and traffic enforcement unit have been tasked to respond, and if we as a police service receive video footage, dash cam footage of the trucks complained of with licence plate details, and we get a date, time, location for the alleged offence, we will initiate an investigation. A reminder that we return to hard curfew tonight, 7 p.m. until 5 a.m. in the morning. Persons not exempted in writing should not be out and about during these hours. Police static mobile patrols will be in place across the islands throughout the night. No other issues arising. Thank you.
Okay, thank you, Commissioner Byrne. Do we have any questions from the media for Commissioner Byrne at this point? Yes, Wendy from CNS, please go ahead. You have a question for Commissioner Byrne.
Thank you, Donna. Appreciate that. I've got 2 questions, actually. One's just a point of clarity. We've had a few people complain and say that the police have warned them to stop doing work in their own yard because they've come under suspicion of doing construction when they're doing construction on their own house, that they're actually doing a commercial.
So the position is you can work within your own grounds. You can be out and about operating within the grounds of your own home, your own residence. I think we've said that, and I'll send that out again through the police command centre to make sure there are clear instructions.
Okay, Wendy,
I'm sure it's hard for them to police it. The second question is, can you give us an update on the voice note that was circulated regarding the governor? I understand that an arrest has been made.
So I can confirm that an arrest was made this morning. Yeah, I confirm an arrest was made earlier this morning. One person is currently detained at the Custody Detention Centre for investigation and interview, and it's not appropriate to say any more at this point.
Thank you.
we do have a question from Reshma at the Cayman Compass.
Thank you, Donna. Commissioner, the 2 individuals that you spoke about who breached the soft curfew, can you tell us if they will be ticketed or if they were just warned for prosecution?
Yes. Warrant for prosecution. You're right, Reshma, the ticketing does come into place today. We're just not ready to start that operation, but they have been warned for prosecution.
Okay, any more questions for Commissioner Byrne? If not, we're going to move on to hear what our Honorable Premier has to say today. Mayor McLaughlin.
Thank you. Hello, everyone. I start with the customary world stats of the progress of the virus through the world. People are really paying attention to this. I thank you for your attention and are suggesting that I add either countries or indeed other information. So one of the questions that has been repeated, one of the requests that has been repeatedly made is that we should also mention, I should also mention the number of persons who have recovered. So the total cases in the world at the last report is 1,411,348, with a total of 300,759 recoveries. There are now 81,049 recorded deaths, which is up 6,395 over last night, and 65,344 cases reported since yesterday. In the U.S., 386,587 cases, up 19,583 overnight. Total deaths, 12,275, up 1,404 overnight. Spain, 140,511, up 3,836 overnight. Total deaths, 13,897, up 556 overnight. Italy, 135,586, up 3,039 overnight. Total deaths, 17,127, up 604 overnight. France, which is increasingly becoming very, very worrying, 109,069 cases, 11,059 cases reported over the last 24 hours. Total deaths now at 10,328, up a whopping 1,417 overnight. Germany still continues to do really well in flattening the curve. 106,739 cases, up 3,364 overnight. Total deaths, 1,942, up just 132 overnight. China, 81,740 cases, up 32 overnight. Total deaths, 3,331. No deaths in the last 24 hours. The United Kingdom, 55,242 cases, up 3,634 overnight. Total deaths now at 6,159, up 786 overnight. Canada, 17,825, up 1,158 overnight. Total deaths, 374, up 51 overnight. India, 5,311 cases, up 533 overnight. Total deaths, 150, up 14 overnight. Philippines, 3,764, 104 new cases. Total deaths, 177, up 14 overnight. Jamaica, we still have the same report from yesterday. 59 cases, 3 deaths. I suspect that just hasn't been updated. Anguilla, 3 cases. Bermuda, 39 cases, 2 deaths. British Virgin Islands, 3 cases. Montserrat, 6 cases. Turks and Caicos, 8 cases, 1 death. New York State, 138,836 cases, up 6,920 overnight, 5,489 total deaths, up 731 overnight. I just want to say a couple of things. No big report from me this afternoon, but I want to thank everyone for the compliance and how well last night in particular went, and today. Very few breaches of curfew, and none during the hard curfew. I think people are now truly understanding the importance of what it is that we are trying to do. We have 114 cases or 114 test results reported today by the Chief Medical Officer. There are 6 positives, but I remain very positive about those positives in the sense that 4 of them are returning students, which I think vindicates entirely the decision to isolate them, and indeed the decision to test them once the 14 days had expired. I know many people will ask and wonder, and I'm not the Chief Medical Officer or even a medical officer at all, how is it that they are still positive after 14 days? There are a number of possible explanations for that. 1, they could have contracted it on the plane. 2, it may simply be dead virus that is still in their blood and is still showing positive on the test results. It is highly unlikely that they are infectious, but we are erring on the side of caution by continuing to isolate them until we've conducted 2 consecutive tests that have negative results. I think that we can still take some comfort and some reassurance from the fact that now some 16 days on since we closed our borders, we still do not have any evidence any real evidence of significant community transmission. Those cases that we are dealing with are still clusters, and so contacts of those clusters are what are now testing, are those that are now testing positive. I do believe that if we can remain vigilant, if we can obey the protocols, if we can practice what everyone is preaching, which is staying away from other people, staying at home, washing your hands. If you have access to a mask, to wear it, any of these things that we do increases the chances of us being able to keep this virus from moving into significant community spread, which is what we are aiming at. I would encourage as many people as possible to have a look at what New Zealand is doing and the results that they have. I just had a quick glance at an article. I haven't had a chance to read it properly on my way here this afternoon, in which the article says that New Zealand is not just flattening the curve, it is squashing it. And they have employed exactly the same measures that we are employing. And of course, many people are rebelling about that as well, unhappy about it, particularly because the results are now so good overall in New Zealand. There's a lot of pressure to relax the restrictions and allow more activity on the Easter weekend. And the Prime Minister has, quite rightly in my view, absolutely refused to be moved on that and has insisted that they will stay locked down for 4 weeks. They have very few deaths, and given the size of their population, very few cases. So we are not the only ones that have adopted this rather draconian, as it has been described by some, approach to dealing with this, but we are determined to, as New Zealand is, to not just contain the virus, but to eliminate it within these borders. If and when we get to that point, it will be possible to relax almost all of these restrictions except the closure of the borders and allow a normal activity to continue. But we first have to ensure that we have run this virus to ground. So I thank everyone for what seems to be increased cooperation and increased understanding of what we are trying to do and the importance of it. I thank you.
Thank you, Premier McLaughlin. At this point, I'd like to just say a big, huge thank you to you and your colleagues in leadership on behalf of the public. I'm sure that you hear it every day, but just a heartfelt thank you to each one of you for leading this and for getting us where we are thus far. Before we move on to questions from the media, we're going to go now to His Excellency the Governor to hear what he has to say today.
Okay, thank you very much, and good afternoon, everyone. I share very much the Premier's sort of assessment of where we are. I mean, yes, 6 more cases is 6 more cases, but it is clear that our policy of isolation, tracing contacts, and suppressing this virus is working. But it does underline we're at a crucial point. We need everyone's cooperation, and the next 10 days to 2 weeks are really, really important to try and keep it that way. I do want to say I'm really sorry to hear about the students who are negative. That must be really tough for them, having been in there 2 weeks, but I know we will try and get them out. I'm positive is what I meant to say, of course. Did I say negative? Positive. So we will obviously try and get those tests done so that they can leave as soon as possible. I do also want to say today as well that our thoughts and prayers are with all those people who have tested positive for COVID-19. We know many people have mild symptoms, but this is an awful disease. It's an awful virus, and very many people who don't need to go to hospital still have very difficult symptoms and situations to deal with. And we do have 2 people in hospital, so I know our thoughts and prayers are with all of those. On the British Airways flight, that has successfully departed this morning, so we have established the first air bridge between the UK and the overseas territories since this this occurred, and it brought in much needed equipment, test kits, PPE, and Caymanians coming back. And I do want to pay tribute to everybody involved in organising that. Andre Ebanks and his team in London, everybody at Cayman Islands government, particularly receiving incoming passengers. The team in my own office, led by Matthew Forbes, Maria Long, Simone Eade, Jill Skinner and Lisa Carroll, who for the last few days have turned my office into a call centre and travel agents, but have performed heroics in making this British Airways flight happen. So my big thanks to them. And finally, British Airways. British Airways have also been terrific. So my thanks to them also. I just want to do a shout out today to on education. First of all, to our wonderful teachers, because prior to the close of schools, teachers prepared paper-based and online teaching resources for students. They continued to provide online resources and support through a range of mediums. Government schools, in partnership with a number of charities, have been providing daily meals to students in need. And ongoing engagement with students has been a critical focus for students as they too navigate the changes required by our response to COVID-19. So we're very proud of the response of the Ministry of Education, the Department of Education and our schools as they continue to look after our students, going well beyond their education. So thank you very much to them. Likewise, a shout out to UCCI, University College of the Cayman Islands, and their faculty and staff, who again have continued to continuously teach over 1,200 students this term, despite the fact that the university campus has been physically closed. And they have allowed over 1,200 students the ability to finish their semester without interruption and reduce the risk of the spread of COVID-19 as well. So a big thank you to Stacey McAfee and everybody at UCCI for everything they have done at this very difficult time. And my last shout out is for Carolyn, our sign language interpreter, who has to work far harder than the three of us up here because she is occupied full time for every second of this press conference. So just to say, we greatly appreciate you, Carolyn.
Yes.
Yay, Ms. Carlin. All right, thank you, Your Excellency. Now we're going to move on to Health Minister, the Honorable Dwayne Seymour, and then go to questions from the media and the public.
Donna, thank you and welcome back.
Thank you.
Caroline and April did you well. Good afternoon, Grand Cayman, Cayman Brac, Little Cayman. You may notice yesterday I didn't do all my usual and I picked up some stress. I even had a lady came over to my car yesterday and many messages saying they look forward to the prayers and shout outs and translations. It made me feel so proud as a Caymanian to have this effect on people here. One person said to me, without God, we are nobody. And you inspired me, and I'm back with my usual. Just to note how much the governor, premier, the CMO, commissioner, the HSA, public health, the press, hazard management, and myself has been here informing you the people we love. We had our first press briefing on February the 3rd, and picked up on March the 12th. We began the regular press briefings, missing a day or so, and today we would be 17 briefings in a row since the 23rd of March, and in total 25 briefings as of today. Give them a silent round of applause, please. Scripture reading today is from Exodus 15:26. If you listen carefully to the Lord your God and do what is right in his eyes, if you pay attention to his commands and keep his decrees, I will not bring on you any of the diseases brought on the Egyptians, for I am the Lord who heals you. Today I want to give a shout out to all those persons who are silently shopping for the elderly or persons who just don't have transportation or the financial means. You're unsung heroes. I want to thank you for extending your hand to a neighbor. Also, I want to give a shout out to all the entrepreneurs out there who are making face masks at home in an effort to save lives. I thank you for the work that you're doing. I just want to say in 1918, some 102 years ago, they were saying the same thing to prevent the spread of Spanish influenza. And they were saying, same thing, please stay home unless it's essential. And today, in our effort to communicate, I'm going to translate Arabic and Russian. Quite out there. but here we go. Aku filbet ila itha Canada rohi. That's Arabic, and Russian is Paza usta ostavai doma isiti ne vasna. Okay. I tried.
The governor will score.
I'll get my scolding after.
Not school, score.
I want to say today, talk about a little bit about face masks. Face coverings made of fabric. I'm sure everyone is aware that the public health expert note that they aren't intended to protect wearers from getting sick, but rather to prevent them from spreading the virus to others. And the advice has always been to exclude using surgical or medical grade masks unless they're in abundance. As experts say, these should be reserved for people who are sick and infected. Just to put things into perspective, over 100 doctors and nurses have died worldwide since April the 4th from COVID-19. Over 66 in Italy alone, 13 in China, 5 in the UK, 1 in the USA, to name a few. But I must note that there's none in the Caribbean as yet, and we thank God for that. But I say to you, on a large part, to the lack of PPEs, personal protection equipment, it is a global shortage, but frontline staff, they are heroes and must be protected if they are continued to save in COVID-19 patient lives. So I encourage you to do your DIY, do-it-yourself masks. As I've said from the start, use face masks when everyone else was a little iffy. I said to use a handkerchief, a bandana, a rag, a towel, anything you can whilst out in public. The Wake Forest Institute states that if you're talking about being better than the medical grade, that you would need an instrument that could at least read down to 0.3 microns, which is the size of a big virus. So the regular surgical mask you see around filters out about 62 to 65% of particles. And for comparison, the N95 mask for healthcare workers mainly filters out about 95% of those particles. The best masks are made with 2 layers of heavyweight quilters cotton with a thread count of about 180 and has a thicker and tighter weave. I mean, the lesser quality fabrics worked well also, as long as they had an internal layer of flannel. So I hope that was helpful for everyone. Today I want to send a message out to Mr. and Mrs. Landlord. How are you doing? God bless you. And I'm asking you to bear this brunt with us. I know the feeling of having a disgruntled landlord where you sneak in late in the night and leave early so they never see you. This is stressful as the pandemic rapidly sweeps across the world, is inducing a considerable degree of fear, worry, and impact of stress and anxiety in the population. In Italy, mental health from stress is now a major concern. Now tell me, who are you going to rent to when you kick out the tenant? What are you going to do with your money if you get it? We can't even go to the bank at times. This is a time when we have money in our pocket and can't even get no love. As Dennis Brown said in 1972, ain't that a shame? Let's be patient and kind at this time, and God will flourish us with when we least expect it. I thank you, Mr. and Mrs. Landlord. I didn't want to be biblical with you, but remember Proverbs 22:8-9. Whoever sows injustice reaps calamity, and the rod they wield in fury will be broken. The generations will themselves be blessed, for they share their food with the poor. Also, to the banks, your lines are too long. Please, I am begging you, open up more than one of your branches. The traffic congestion is a problem, also especially with the condensed opening hours. Ladies and gentlemen, the World Health Organization has designated the year 2020 as the International Year of the Nurse and the Midwife. The World Health Day is a global health awareness day celebrated annually on the 7th of April today under the sponsorship of the World Health Organization. This year's focus of the World Health Organization is to support and celebrate the work of our nurses and midwives. On behalf of my cabinet colleagues and the people of the Cayman Islands, I extend my gratitude to all those who serve these islands in this noble profession. This designation by the WHO is a momentous occasion as it marks the first time that this global body has designated a year for a single professional group, signifying their essential role in the health and well-being of our population and the inextricable link between health, national development, and the economy's sustainability. This country and our people owe a debt of gratitude to all nurses who have served in various capacities throughout every generation, from the early pioneers such as Miss Leela Yates, Cayman's first nurse, Miss Josie Solomon, and the many other dedicated and committed professionals who now make up the profession. They continue to provide care in a variety of settings in the Cayman Islands with one shared objective: to offer the best health care to everyone in these islands. On a personal level, we can relate to the impact of a nurse in our lives. There are very few of us whose lives haven't been touched by the comfort and reassurance that nurses provide. Every hour of the day, every day of the year, from before the moment of birth, through crisis in our health, to the day we pass away, a nurse is always there. I am pleased with the proactive approach already taken by the government in creating a nursing program at the University College of the Cayman Islands to provide career opportunities for Caymanians, ensure the sustainability of our healthcare system, and reduce the impact of projected global shortage of nurses in our healthcare system. We will continue to provide any resources and incentives for young Caymanians who choose a career in the healthcare field and wish to return home to their country. However, we recognize that there will be need for more experienced specialists and skilled nurses who will need to recruit to fill critical roles to guarantee the sustainability of a high-quality public health care system in these islands. Our ministry is committed to this important consideration. Today, I salute, thank, and appreciate nurses and midwives and all other healthcare workers, whether in the public or private sector, for your commitment to these islands and the years of devotion in caring for people, especially at this time as you are in the frontline workers of the COVID-19 response. Congratulations to you on your well-deserved year dedicated in your honor, and I wish for all of you a long and successful career in this your chosen profession. I thank you and God bless.
Okay, thank you, Minister Seymour, for that, for those words. We'd like to now open up the Q&A session, starting with April Cummings from Radio Cayman. April, please go ahead.
Good afternoon, everyone. I hope you can hear me. My first question is for the commissioner. I think this is most appropriate for you. We've received a couple of messages from listeners who have very large households. So it's sometimes 4, 6, in some cases 8 people in the household. They say they're respecting the rules, they're staying at home, but they are celebrating outside on their property, playing dominoes, that sort of thing, and have, in multiple instances, been approached by officers who said they can have no more than 2 people outside, even though it's on their own property. Could you speak to that a little and clarify that for us?
I can clarify and confirm that you conduct family activities within your own grounds or on your own property. So it's a message I will just have to go and reinforce with my officers back through the command centre.
Thank you, sir. I didn't mean to giggle, but it did make me smile. The other question, I'm not sure whether it's for the commissioner or exactly who answers it, but it has to do with landlords and whether they're required to be registered as businesses and whether government has the capacity or the legal standing to perhaps stop evictions during a time like this.
It's not the commissioner.
No,
Whether we have the power to stop landlords evicting people at the present time.
No, we don't. We don't have the power in law to stop a landlord from evicting a tenant because they aren't paying the rent. I'm getting increased numbers of messages from landlords saying that they have tenants who are not paying the rent and appear to be making no effort to seek assistance otherwise from NAU or anywhere else. So I see this problem starting to bubble up. Each case is different, and the circumstances are often different. It's very difficult to make a judgment about whether all landlords are behaving unreasonably or tenants are behaving unreasonably. All I will say to everyone is that if we can soldier on through this time that we're in for the next few weeks, and we don't wind up with widespread community transmission of the virus, a whole lot of things will be able to change as far as the local economy is concerned. So at this stage, I just exhort everyone to be patient as you can, and to be as reasonable as you can, whether you're a landlord or tenant.
Thank you, Premier McLaughlin.
Thank you, sir.
Any other questions before we move on to Wendy from CNS? Okay, Wendy, you have a question?
Yes, please, Donna. Thank you. I'd like some clarity. My first question is just quite simple. Did we get a date for the expansion on the closed borders? Because obviously that expired, the original, or it's about to expire. So I just want to make sure that we have an official period of time that's written down about the borders being officially closed. I don't know whether the Premier wants to answer that first, and then I'll go on. I've got 2 very related questions after that.
Right. So we haven't officially taken a decision yet. By that I mean Cabinet hasn't yet made a decision. But I've had a discussion with the Deputy Premier, who's the Minister for Tourism and responsibility for the ports as well. And he is suggesting that we close it until the 30th of May. So that we'll have a Cabinet meeting during the course of this week and address that then. But that's certainly the suggested date now.
Okay, great. The other questions really relate to the whole situation around deliveries and food and all that kind of thing. The first one is we've had a few people that queried whether health and safety protocols are being observed at this time, because obviously there's a lot of people working now to get food made, to deliver. People working in very close proximities. And so we just wanted to double check that the Department of Environmental Health was still working and still checking that these places are safe and people are practicing social distancing, but also the usual protocols of food handling are being well managed, because a lot of people are obviously relying on them. So I don't know who can answer that question. And the next question is really about coordinating deliveries and whether government could find a way to get involved with the private sector to employ delivery drivers, and if we can't privatize the nationalize the supermarkets, but could we not nationalize the delivery system in some way? Government use its public funds to pay for drivers and really ease that burden and also help those that can't get out. That's pretty much my bag. Thank you.
Well, I can't give a categoric answer with respect to the first question, which is all I can do is ask, go away and ask for a report from Environmental Health about those matters. But we certainly haven't, at least they haven't filtered up to me, any complaints about the way the restaurants are operating. With respect to delivery services, we've talked about this a number of times. The private sector is working to find, and they are finding employment for a number of people who would otherwise not be employed. We have a whole bevy of taxi and tour operators who drive for a living normally, who have no work now. And the Chamber of Commerce was certainly helping to try to put that together. Woody Foster in particular, I think, was heading that up. I don't think government should jump in and take jobs now from people who would be able to make a few dollars doing deliveries. This may go on for a while yet, and there are more than enough people out there who drive for a living who ought to be available to help with the delivery service.
Okay, thank you, Premier McLaughlin. Any more questions from you, Wendy?
Actually, I'll give way for a minute so I can make notes and then come back if you don't mind. Thanks.
Okay. I have a few questions from the public, myself. Premier McLaughlin, of course, everybody wants to get the latest update on pensions and where those talks are at.
They're at the same place they were yesterday when I reported. We now do have the report from the pension providers. So this afternoon I will spend some time considering that myself, and then we'll have a broader meeting across government to make some decisions. I've said I've had the AG working on how we can hold a meeting of the Legislative Assembly. I think he has come up with a workable plan, and does require some creativity, but I think it can be done. I just need to have a discussion with His Excellency the Governor as well as my cabinet about it. But we might be able to get to the Legislative Assembly as early as next week.
Okay. So for our listeners out there you have it. Also, another question as it relates to restaurant delivery and pickup. Are pickups allowed, or is it delivery services only? There still seems to be a mass amount of confusion as to what people are actually allowed to do.
Right, so both delivery and takeout are permitted.
Okay. And pickup would only be on the days that their last names fall on, as in supermarket
I was
shop?
hoping you wouldn't ask me that question.
But this is a part and parcel of the question. Yeah, so is it only on those days, or is it generally that persons are allowed to do pickup?
No, pickup of food from restaurants is permitted every day during the soft curfew hours, but not on the hard curfew day.
Okay. Also, if you could reiterate again about exercising. People are confused as whether they can exercise for an hour and a half every day during the soft curfew, or is it only on the days that their last name can be used for supermarkets?
So you're permitted 1.5 hours of exercise every day during the soft curfew hours, starting at 6 and finishing at 6 p.m. 6 a.m. and finishing at 6 p.m. It is 1.5 hours from the time you leave your property until you get back. Not 1.5 hours on the 7 Mile Beach and then 15 minutes to get back home.
Okay.
So don't be out on the exercise mission outside those permitted hours, 6 a.m.
6 p.m.
to 6 p.m.
Okay.
So I went out yesterday with one of my sons as well for the first time, and we went out quite early, as early as was permitted. And I can tell you, the police were out in numbers. One very nice officer even asked me if I thought I might need an escort at home, and I told him no, I was just perfectly fine. So don't believe you're going to get out there and beat the police, because you're not. They're going to be there.
Okay. Thank you very much, Premier McLaughlin. Also, two other questions to His Excellency. One, is there another planned BA flight anytime soon that would afford us the opportunity to get more supplies and hopefully for more persons who are Caymanian or resident here to return home?
Well, I think we've shown we can do it. So that's clearly positive. I know that the Premier and government are now actively looking at how we can help people who are on islands who want to leave, and that's our next big challenge after the BA flight is out of the way. The travel hotline is still there for people who want to register an interest, and I know government will now be looking at what we can do on that. And the BA option to London is clearly something we could do again if, in that exercise, there is demand for people to go to London.
Okay, so when you say others, you mean people within the region and maybe the USA?
Yes, we have Cayman Airways, and so we could organise flights within the region, but that's a matter for government, and we need to see what the demand is. I think my office can help with the sort of diplomatic side of it if we need to be approaching other countries, Philippines, India, for example. So it'll be a collaborative effort, but I think this is now a big challenge for the next few days and weeks.
Okay.
Like I just wanted to add one thing to that, Donna, because I've been getting a lot of calls in terms of flights. Everybody, I mean, I tell people all the time, listen to the press conferences every day because it's something important that would probably relate to you. Right. And people are calling about flights off the island to Jamaica. People are calling about Santo Domingo, Nicaragua, Honduras, in the region. And I'm saying to them, just call the number 244-3333 or email. And it seems like people are waiting for us to say a flight's going to Jamaica and then they want to book. This is not the normal circumstances. We want you to call so that we can put our efforts into organizing what we need to, because there's a considerable enough amount of stuff that needs to happen for flights to even go on in these kinds of in these times.
Sure.
With other countries and so forth. The governor and premier has to do some formalities, you know. So we're asking people to please call in 244-3333 and register the destination.
And of course, another important factor in that is that you want to make sure that you have enough numbers of persons
Yes.
that want to go to the same destination. You're not going to send a flight with 5 people.
Yes.
Yeah. Okay, we got that.
So,
all right, we're going to.
So just let me say this. This is not as easy as you might think. Many airports are closed, borders are closed.
Yes.
Let's take Jamaica. So in order to get a flight to Jamaica, we will have to persuade the Jamaican government to allow us to land in the first place. So we want to know how many Jamaicans because I don't think they're going to accept any visitors, how many Jamaicans want to return home, to see whether it is worthwhile going to those lengths and putting on a flight there. The other thing that we have to consider is that there are likely to be people who want to come back here. Now, when we expose our pilots and flight crew to persons coming back on the plane, we are going to run into issues of perhaps needing to isolate crews. So this is not a simple and straightforward exercise. So it's got to be truly worthwhile, the exercise in terms of the numbers of people, for us to go to those lengths.
Okay. Premier McLaughlin, thank you very much. We're going to move now to Reshma. Reshma, please go ahead with your questions.
Thank you, Donna. This one is for the Premier. We've gotten a lot of positive feedback from the announcement yesterday for the small business owners and the lifeline that's being tossed out to them. But similarly, we've also gotten some feedback from business owners who are in 60-40 partnerships. They're asking if government would consider any sort of lifeline or support being extended to them to assist them to weather the storm as well.
The only part of what was announced yesterday that is not available to any company other than 100% Caymanian owned is the loan from Cayman Islands Development Bank. And that's because that is part of the mandate of that bank. They can only make loans to 100% Caymanian owned entities or to Caymanians. But all of the other aspects of the program that Minister Hugh rolled out are available to all Caymanian companies, i.e., including those that are 60% Caymanian owned.
Okay, great. Thank you for that clarification, Premier. We've heard about people doing do-it-yourself face masks and trying to, relax the demand for those masks, save it for the healthcare workers. Would it be allowed for like the fabric stores to be able to, say, donate materials to the public so that they can have access to that so they can create their own masks?
Well, if I may, Reshma, what we don't want is because to be able to move about, you need to be an essential employee. So what we want is for companies to be doing these rather than every individual. I know it would seem nice for every individual to be doing it, but when you apply to the curfew time at gov.ky, you're applying as a company to get permission to be able to move about and to sell goods, etc. So as much as I'm an entrepreneur and love that spirit, I would want them, and I think you can probably even, you could probably still open a company online. I stand to be corrected, but I think you can even register a company online now, as we speak. So I prefer them, or for persons who already are established as a company, to be the persons doing these for some of the reasons that I set out just now. Otherwise, we're going to have people trying to go all over the place and get themselves in trouble. We don't want people to get in trouble, although I like the spirit of persons trying to help themselves and making lemonade out of lemon. But we ought to be careful how we do that. Maybe they do it through someone else or do it through another company or something, to try to get the approval to be able to move around and to sell them. Because here at the ministry, if someone has a company and sends us their product and we approve the design of the DIY, we are even willing to take some of these so that we can distribute, whether it's amongst the civil service or even amongst the public. So we're trying to encourage that, and we have taken on board some persons, some companies who have wrote to us, and we are now in negotiation with them. So it's something that we're encouraging, but we ought to be careful how we do it to ensure that we're doing it within the law.
Okay, thank you for that, Minister Seymour. I just have two more questions. If Dr. Lee is still available, I just wanted to ask a quick question. The BA flight that came in and the individuals that came in on that flight, are there any plans to test them rather than wait for the 14-day period given the positive test that we got from the students today?
Sorry, Reshma, I didn't entirely understand the question. On the BA flight that's coming in to yesterday, is that what your question's about?
Yeah, the passengers that came in yesterday, are there any plans, in light of today's findings with the positive students, are there any plans to test those individuals now rather than wait for the 14-day quarantine period?
No.
Sorry?
No. We would wait for the 14-day quarantine period. That's the nature of the quarantine period, because they need to spend that time just in case the virus. The incubation period, we know the average incubation period is around 5.5 days, but the span is anything from 1 to 14. It's odd that the students that tested positive way out at 14 days, but as Premier mentioned, it is possible for some people to shed virus so that you pick it up on the test, on the blood test, even though the virus is dead and the body has actually raised the immune response necessary to beat the condition. And certainly I don't believe that any of these 4 had been symptomatic, although I'd need to check and they'll get assessed in more detail, but I don't believe they were symptomatic.
Okay, thank you for that. This question is for the Premier. In your report today, you talked about 3 deaths in the overseas territories. I wonder if you would comment on those deaths, and do you see this as maybe a kind of take stock for the islands on the COVID-19 situation with our brothers and sister islands?
Well, I actually don't know the circumstances involving the 2 deaths which occurred on the same day in Bermuda. I haven't had a chance yet to talk to my friend Premier David Burt about that. But the Premier of TCI was actually on our chat. We have a BOT leaders chat, and unfortunately, the death of the young man, and he was a young man, in the Turks and Caicos Islands has really shaken them. He's actually the brother of one of the members of parliament and quite a young man and very popular. Again, a clear indication that this virus is no respecter of persons, even though it tends, if you look at the data, and you look at the profile of the average person who does die, they tend to be pardon me, they tend to be older males or persons with underlying health issues. It's not just those that die.
Thank you, Premier McLaughlin. If we have no further questions from members of the press at this time, I do have one other question.
I'd ask for follow-up, Donna.
Okay, just a moment for me, Wendy. I do have a question for His Excellency from the public regarding the BA crew that came in yesterday. I know you mentioned that were they in quarantine? Where were they in quarantine? How did that work? How did that process?
Yeah, they were fully in quarantine, and that was handled extremely effectively, and no problems whatsoever.
Okay, awesome. Thank you so much for that. Wendy, can you please go ahead?
Yes, thank you. One question is there a list of available that shows all of the exempted businesses, or is that too much of a proposition because of the quantity? That was a question that quite a few readers have asked us. Another question is a bit more generic about yesterday and the stimulus package. We've had a lot of people that are saying it's not really helpful to them now. And they're really just not getting through with their needs assessment unit, and there are some people out there that do appear to be terribly desperate, and I think they're hoping for some comfort in terms of what they do today and tomorrow as opposed to further down the line. Are there any plans for a much bigger stimulus package that's happened in the same way like in the States and the US, where the government has pumped money into the economy for employers to keep paying people even though they're not working? Any thoughts?
Well, let me answer I don't know if I can remember the first question, but...
It was about the list.
About the what?
List of exempted companies, if it's available. A list of exempted businesses that are allowed to be operating. We've had a few people ask for that.
Please don't ask for that.
Too long, huh?
Well, the thing is that the way that the regulations are set up, there are a number of categories of businesses that are exempted under the regulation. So under the regulations, which are the critically important businesses to keep life and limb together, essentially. And so what we ask is for the employers, the owners of those businesses, to write to curfew time to set out the names of the essential people that they need, so that when the individual is stopped, as they drive around, the police can be presented with a letter saying, I'm an essential worker. So there's a whole long line and list of those. Then so those are the ones set out in the regulations. Then curfew time, the competent authority, which is the Ministry of International Trade, they have the ability to also, under the regulations, declare certain businesses as exempt. And then there's a list of persons that employees they're asked to send in to get approved. Then, of course, because we all have the various exigencies of life, you have certain, let me give you an example. The law firms, let me say Walkers. workers are not regarded as an essential business, but obviously they have all their staff working at home. What's essential is that their IT systems stay up and running. So you get a number of IT employees at Walkers being exempted and declared essential for that purpose. And they're given perhaps so many hours of a day, which is agreed, so that they can go and fix these various things. So that's why the process is so complicated and so ongoing. I mean, I kid you not, yesterday, I don't know what the final number was we arrived at, but by the time I came here to the press conference, we had received over 300 requests for exemptions yesterday. So that's the nature, and so we have to sort through these. Only the really controversial ones get kicked up to me. But I go down there from time to time, at least to try to offer some moral, some moral encouragement to the team that is working. We've got people now. We're working 13 hours a day, just keeping curfew time running. We've split the people into shifts. I say all of this just to say that please don't believe that this is working as well as it is. Just so. There's a whole lot of effort and energy that is going on. And I really want to give a shout out to the team there who are carrying out this incredible important work and doing so with such great spirits. And also to the many restaurants who are constantly sending us food, which is good. Although I think everybody's going to be very fat by the time it's all over. But yes, it is more than a full-time job. As I said, we're working 13 hours a day now, just managing those requests.
Okay, thank you very much.
And so, Wendy, you had another part of the question.
The other question was about the exemption, the package that was announced yesterday, the stimulus package.
Right.
We've had a lot of people tell us that they're desperate. They've applied to needs assessment unit, not heard anything. They're hungry now, especially people in tourism, and they're just saying, why can't we do something like they have in the UK or the US, where government pumps money into the economy and so employers can pay people or whatever. Anyway, any thoughts or
Well, that's exactly what we're doing.
ideas for those people that say they're hungry today? Help me.
Right, but what was announced yesterday had nothing to do with individual people. That had to do with that's a $14.4 million package of money going directly into the economy, but to support small and micro businesses. Part of it was actual wage subsidy, as well as the soft loans program, which is about $5 million to businesses. It is not a stimulus package. It is a survival package. And government, that was aimed at small and micro businesses. Government has right up front paid cash to tour operators, taxi drivers, some of those that operate the boats. We're working on another group of individuals that has been category of employees and businesses who are identified as, they actually have no income because what they did no longer is happening in the economy. So we're working on that as well. And as far as NAU is concerned, that is now up and working. As I said yesterday, we had 136 applications. Those checks will start going out, or food vouchers and stuff will start going out this week. We are continuing to look at how we can support the economy, but we are not in a position as the UK where we can offer 80% of the salary to every single person who's unemployed in Cayman. We simply do not have those resources.
I might just add, I do know that there are many people in the private sector out there who are making lots of very welcome offers of how they can help people who might sort of have fallen on hard times. And the Premier and I are going to be meeting a number of private sector people out there to see how we can pull all this together. So government is doing, I think, a huge amount, but we know that the private sector wants to help as well. And it's just important to try and bring all that together in a coordinated fashion.
And I think what Minister Hugh was focusing on yesterday is trying to get people to start thinking about what am I going to be able to do in terms of business over the course of the rest of this year. because what I'm doing in tourism is not going to be around for many, many months. So there's no point in them or us pumping money into businesses which are not going to survive for 9 months or 10 months. They've got to refocus, repurpose what they do to try to find some traction within the local economy over the course of the next little while. There are businesses that are going to fold. Some are already folding. The restaurants, particularly those that cater to tourists, are just, many of them are just not going to survive the length of time that the place is going to be shut down. And I think we're going to have to face some of these hard realities and see how we can help as many people as we possibly can survive over the next however many months it is. I mean, my projections are that, you know, the world is unlikely to open back up significantly, I think, before next year. So that's the kind of time frame the government is looking at and trying to make provision for.
Okay, in an effort to start wrapping up the press briefing, we're going to move on to April Cummings from Radio Cayman for a final question from her. April?
Mr. Premier, this is more kind of a concern raised by a number of folks because there are so many people out of work right now. And even though they're not going to get their electricity or water shut off, and if they have a mortgage, they're not going to have to do the payments right now, there are concerned that these things are going to back up on folks and they're going to have an extremely difficult time, maybe not today or tomorrow, but in the months to come. So they just wanted you to address, if you could, maybe what kinds of approaches are being thought about to perhaps assist people, not just tomorrow, but in the next 3 to 6 months. And these are more employees, I think, than employers.
Well, I don't think I can say much more than I said just now, quite frankly. We are going to use as much of government resources as we can to help people through these times, but government itself has limited resources, and we have to be able to continue to operate, to pay all government staff, to pay all government outgoings, and to help with these various things for the foreseeable future. I think one of the things that many people may not be realizing is that government's revenue has fallen off precipitously. All of the tourism revenue is just non-existent. The way it's non-existent for hotels and restaurants and tour operators, it's also non-existent for government. So a lot of work is going on in the background to see what we can do to help people. We don't have all of the answers now. I wouldn't pretend that we do. But what we've done and are doing is putting in place as many possible measures as we can to ease people, the pressures on people to pay bills over the next little while collectively we try to find a way forward in the medium to longer term.
Thank you, sir. That sounds like an answer to me.
We're thinking about it, believe you me.
I'd just like to insert this bit of information for those who are interested or need to get instructions on how to register their companies. They can go online to CI registry@gov.ky. That's CI registry@gov.ky for any instructions there. Any final words from our panelists as we wrap up this afternoon?
No, just again to thank everyone for what appears to be increased cooperation with the measures that are in place, and to say to everyone that we are quite upbeat on this end. By no means celebrating yet, but we really think that Cayman is in an excellent place 14 days after the close down of our borders, and that we are increasingly optimistic that if we can keep the faith and if we can continue to do the things we need to do in terms of social distancing and cooperation, that we can actually get through this and come out the other end in a really, really good place and provide not just a great deal of comfort to ourselves, but also provide a beacon to the rest of the world about how you can manage a pandemic situation like this if the people are in solidarity and appreciate that we're going to have to suffer in the short term to ensure that in the longer term we're still alive.
Thank you, Premier McLaughlin. Before we go, a reminder to go online to gov.ky/coronavirus for any unanswered questions or to those that you may need answered. And I'd like to just say thank you to everyone who's made today's press briefing possible. Of course, our panelists, everybody that works here on this team, our sign language interpreter, you, of course, our viewing and listening public. We thank you for joining us, and we hope you'll do the same again tomorrow. Have a good one.
I know many persons are tuning in right now hoping to see another episode of Double Six Pose. But as this is the final day and myself and many others are going to be in the isolation facility, we wanted to say thank you. Please enjoy.
Thank you, thank you, thank you from the bottom of my heart. It's Judith Crawford from room 212.
Big thank you to the isolation staff from room 522, Kayla Elliott.
Thank you to the isolation team from Andres McDermott in room 525.
Hi, isolation team. I can't thank you guys enough. Coming from room 312, Shakira Eli.
My name is Shamel Williams, and I'd like to say thank you to the isolation team from room 331.
To everybody in the isolation staff here at Comfort Suites, I really appreciate everything you have done for us in the past 2 weeks. And I just want to say a big thank you and much love from Torian Shields in 49.
Thank you from Chelsea Frederick in room 430.
Thank you to the isolation team from Dominique in room 308.
I would like to sincerely thank the isolation team here at the Comfort Suites for making us feel so at home for the last 2 weeks. I'm room 324, Martina Bodden.
Hey isolation team, Jacretia from 521. Just wanted to thank you for all the work you've put in these past 14 days. Thank all of you guys.
Just wanted to say a big thank you to the isolation team from room 224, Jessica Holston.
I would just like to say a big thank you to the isolation team. This is Joel Gale, room 313.
I'm Renee from room 404, and I would like to say to the staff who have been taking care of us in isolation, thank you very much. Your work has been appreciated.
Thank you from Jeffy with the Belly, room 416. Yo, you're forgetting to thank the government and everybody who helped us. Just give me a minute now, brother. Watch out, now you're gonna go vex me.
Hello, Cayman Islands.
My name is Sergeant Gill from the Cayman Brac Detachment.
I am Lance Corporal Thompson from the Cayman Islands Cadet Corps.
This is Corporal Carter from the Cayman Brac Detachment.
I'm Corporal Alawanya an NCO from the Cayman Islands Cadet Corps.
I am Corporal Williams from the Cayman Islands Cadet Corps.
I'm Corporal Hansraj T from the Cayman Islands Cadet Corps.
I am Corporal Webb.
I am Lance Corporal Ferguson.
My name is Corporal Blakey.
I am Lance Corporal Camarty from the Cayman Islands Cadet Corps.
I have a very important message for you guys.
COVID-19 is having a huge impact around the world and affecting everyone's lives.
And I wanted to say,
keep washing your hands and practice social distancing when necessary.
As young Caymanian cadets, we have pledged to uphold the importance of
following the advice of our medical professionals
and government leaders to stay at home.
Caymanians, residents of the Cayman Islands, listen to what I have to say. Stay home, Cayman, to save Cayman.
Stay home, Cayman, to save Cayman.
Stay home, Cayman, to save Cayman.
Stay home, Cayman, to save Cayman. Thank you.
This message has been approved by the Cayman Islands Cadet Corps.
Impact in the community.